Berberine's a really fun word to say, and it might be worth considering if you have diabetes, high cholesterol, PCOS, or are overweight in a way that it affects your health. Berberine is a yellow-colored compound found in many plants that have been used in traditional medicines, especially for GI infections. It's incredibly bitter tasting, and this bitter flavor is actually key to some of its effects. But before I tell you why berberine is so amazing, let me tell you when you definitely shouldn't use it. If you're taking blood thinning medication, don't use berberine. If you're taking medicine for diabetes, talk to your doctor or pharmacist first because berberine is so powerful it might make your blood sugar drop too low. And while it hasn't been studied scientifically, if you're pregnant, be really careful with berberine because traditionally most of the plants that contain it are not for use with a bun in the oven.
I smell a bun in the oven.
Now, if your LDL cholesterol or triglycerides are too high, berberine might be your friend. This meta-analysis of 16 randomized controlled trials concluded that berberine improved lipid profiles with a pretty good safety record. However, the trials included a risk of bias, so we should do better. For PCOS, this meta-analysis showed something I found really interesting. Berberine had very promising prospects and was similar in many ways to metformin, but not statistically significant. In traditional medicine, herbs with berberine are sometimes indicated for the patterns that PCOS presents with, but we more often go in the direction of using cinnamon, which has better efficacy in this randomized controlled trial. And the main formula that gets used for PCOS with cinnamon in it has also been successfully studied. Now back to berberine. For obesity, this systematic review of 35 studies showed different mechanisms by which berberine might be useful in medically supervised weight loss. But there was a caveat. Berberine reduces diversity of gut microbiota. Your gut microbiome is sacred, and while it is probably okay to clean it up from time to time, there is an association between thinning the herd and the development of chronic illness. So in the context of that, berberine is probably best used intermittently for short periods of time in combination with other conservative methods like regular exercise and very mild caloric restriction.
New diet?
And this is consistent with traditional use. Berberine has an antibiotic-like effect and is in many classical formulas for things like bacterial gastritis. It's even been shown to work alongside antibiotics to make them more powerful and even more effective against antibiotic-resistant bacteria. This is the best of old and new working together. Berberine is powerful plant medicine, but to get the most benefit from it, we need to look at the context for its traditional use along with the modern evidence.